This pressure and immobilisation technique is the best method to treat any snake bite in Australia. Okay, just stop. Calm down. Come and sit down. Okay, just come and sit down. Sit down. It's okay. Sit the patient down in a comfortable and safe area. Minimise movement. I'd like you to call 000, which is the emergency number in Australia, and ask for an ambulance to this location as soon as possible. And this is a medical emergency. Okay? Down. And take your boot and sock off. Okay. Now what I'm going to do is put a pressure bandage on here and immobilise your leg. I'm going to start with the first bandage just below your knee. Your bite sites there, I can see 2 little fang marks. And I'm going to put this bandage on and force the venom to stay down this part of your leg. Okay? And I'm stretching this so it doesn't stretch anymore. And each bandage wrap is about half the width of the bandage. And these are 10 centimetre wide bandages. As soon as possible, commence above the bite site and bandage down. Proceed up the limb with the second bandage until you reach the groin or armpit area. How are you feeling? And I'm going to bandage over your clothing, because you can do that with shirts and trousers. And just give me your last bandage. Okay. Just over this last, so lift your tie out. That's it. Check the circulation by squeezing the blood out of your toe, and the colour should come back within 3 to 4 seconds. If the colour comes back, you haven't cut off the blood supply. If it has, then you have to remove the bandages slowly and reapply them at the correct pressure. Mark the outside of the bandage with a circle at the bite site and include the time. The hospital staff can easily identify the type of snake from the venom left behind at the bite site. Do is tie your 2 legs together, just like that there, like that. Before you move the person, immobilise the limb by putting a splint on or tying the ankles together. Don't run too far. There you go. Limit the patient's physical movement by having transport come to them. Do not let them walk on a bitten limb, carry them. If a person is bitten on the arm, do exactly the same thing, call for an ambulance and reduce any movement. Before you apply the bandaging, remove all jewellery from the limb. Bandage down first, second bandage goes up, check for circulation, mark the bite site and the time. Do not wash the bite area. Do not suck venom from the bite site. Do not attempt to catch the snake. Do not elevate the bitten limb. Do not apply a tourniquet.